All right. Good morning, Carol Johnson.
Good morning, Bob Ponce.
How are you on this fine Wednesday, October 28th?
Well, thankfully, the weather never affects my mood.
Mm-hmm.
Yeah.
Good, good. So we've got a great show today. We are going to talk about the data coming out of New York City regarding COVID. Can you trust it? And we've got somebody who's hopefully going to help us answer it. Carol, you shared with me an article last week that was very, very insightful. It was by a reporter, Will Welch, who is with thecity.nyc, which is a really great news site that's been doing some great, insightful coverage of what's going on in New York. And so we are pleased to have Will here with us this morning. Good morning, Will.
Morning, great to be here.
Great to have you here. So, Will, you have been covering COVID-19 from the status of, just data gathering and dissemination, really since the very beginning. So, can you share with us a little bit of that process, and then we want to talk about some of the insights that you had in your article?
Sure. So the city decided to start gathering this data almost as soon as the pandemic hit. And initially it was a very manual process of getting data from PDFs that the Department of Health was releasing and putting those into Google spreadsheets, and analyzing trends, seeing where things were going. As a result of that, we published a tracker where we now watch that data on a daily basis. As the Department of Health has changed how it's released data, we've started to automate that process a little bit, and release different kinds of data as it's become available from the state, from other sources. So it's really an evolving process, and the Department of Health changes frequently what it's releasing and what's available and what we can get out of that. So absolutely, it's sort of been an evolving process, and now we're looking more specifically at zip code data as we're trying to focus on where hotspots are emerging and how the virus is spreading throughout the city.
Mm-hmm. And so, in looking at that, you reported last week discrepancies in terms of numbers that the mayor's office was putting out versus numbers that the health department was put out. Can you tell us a little bit about those?
Sure. So the mayor began releasing data during his press briefings about positivity rates in different zip codes. And that's based off of Department of Health data that is really not public at this point. The best available data by zip code is a cumulative number of all the cases, tests, and other metrics that have occurred since March. Really, just one total number. And from that number, you can see day to day, if you look at the cases today and subtract the cases from yesterday, you can get a rough idea of how many new cases there are. But that number doesn't necessarily reflect the number of cases that resulted from tests taken on a particular day, which means that if you try to compare those numbers that the mayor is using, which are based off of a more accurate version of that data, you're going to see a mismatch, which is what we found. So essentially, we can produce some numbers that produce a general sense of what's going on. But if you try to compare those to the numbers that the city is using, they really don't match up.
So how does that impact us now that we seem to be looking at a second surge here in the city as well as countrywide?
I think the real challenge is for local leaders and community members to see what's going on in their community. Again, there are some general numbers that the city releases about this. The most useful number for this right now is a 4-week cumulative number of the number of cases and tests that have happened. And that 4-week number is released once a week, 5 days after the last data that's included in that number. So once a week, you can get a general 4-week sense of what the positive rate is in your zip code. But again, that's not the same as the 14-day positive rate that the city is using more accurate data. So the challenge is respond to this in real time. You can get a once a week glimpse, but getting a daily glimpse, seeing what's happening every day, and specifically what's happened very recently in the past 2 weeks is just very challenging now.
And
Yes.
and and that seems like that's absolutely necessary. I mean, if there's anything we learned in March and April, is that there's is the time lag. By the time it gets to hospitalizations, we're already, it's already too late to respond to it. And we saw how you could see the lag between our responses and actual changes in the data, and that 2 to 3 week time lag. In that time, so many more people can be infected if people are not aware. And so it just seems that we have enough, we know enough about it now that we have to be so vigilant about the numbers on a daily basis so that we can spot the trends early enough to alert people to raise their preparation level, which is what our main concern is that we feel like people got a little comfortable and lax in the summertime, and now we're coming into fall, and you know some people don't wear the mask. Some people are wearing the masks around their chin instead of over their mouth. Some people are not washing their hands anymore. They're not social distancing, and it seems that if we can't stay on top of these numbers, especially on a localized basis, that we run the risk of seeing some of the same things occur that happened in the spring.
Yeah, and also with the holidays coming, we're really fearful that those numbers are going to rise. And, so I thought that this really needs to be pushed out further about families gathering, and, still you have to keep smaller groups of people. We're people that love to party. It's just that simple. And, as dangerous as it may be, it doesn't seem to be driven home. We just think that the city needs to push that a little harder, a little further. As Barb and I started this program, we always talked about tuning your immune system, getting those vitamins and things into your system, and be careful what you eat, change the way you eat, exercise, different things like that. But these seem to be points that you're looking at an uptick, but you're not pushing home the things that need to be said now, because we are entering even Halloween, but Thanksgiving and Christmas is coming. And our communities, um, although we don't believe the numbers were accurate because we didn't have any testing sites, so we don't know how, in particular, East Harlem was the hardest hit in Manhattan. We only had one testing site. We have 98,000 people. So we couldn't figure out how we were the hardest hit. But if that was the case, according to their stats, they really need to be pushing it out to the areas that were the hardest hit so that they would understand. These communities didn't even know that unless we were pushing it out. So that's why we
Absolutely.
want you to come on, to help people to understand just how serious this is. And we're not out of the woods.
Yes,
And
absolutely. And the having that information is one of those ways that is sort of empowering and gives you the information that your change in behavior is making a difference, that your mask wearing is making a difference. A lot of public messaging about mask wearing is it's more effective if you empower people to feel like they're making a change, as opposed to creating a sense of shame or creating a social expectation of mask wearing. Knowing that you're making a difference is a powerful way to encourage that behavior, and releasing that data is a powerful way to enforce that messaging.
And I don't feel like we're as bad as some of the other areas in the country when people are just feel like wearing a mask is an affront to their liberties, and most New Yorkers, I think, at least acknowledge the need to it. But I think it's important for people to understand that the data supports this. I saw a post something in the Washington Post that showed that the states where people were wearing masks are the ones where they're seeing declines, and the states where people are not wearing masks are the states where the rates are going up. And so that's encouraging to know that it does make a difference, but we still see pockets of places, obviously in Brooklyn, where there's a significant community that just feels like wearing a mask is something they don't want to do. And they were burning masks out there, which we felt was really incredible considering how much work we had to do as a community organization to just disseminate and distribute masks to people who didn't have them. And so we were shaking our heads about that one.
And that was months of searching and fighting to get PPE. But we managed to find certain organizations. Thankfully, some of the people were right here in East Harlem, where they was able to get us hundreds of thousands of masks. But that was later on. It was much later on, you know. And to see these things being destroyed willfully, it blew my mind. I'm saying people had things that just, some of the coverings, face coverings they had weren't appropriate. They wouldn't cease anything from getting through those materials, porous materials. And so people were just grabbing whatever they had. And it was very, very sad. But we were able to, at some point, get a lot of masks. And it's crazy how so much attention is being paid to certain areas that's just being willfully neglectful.
Yeah,
And yet, pardon me, when you saw upticks, there was no attention paid to those areas. So even now, we're wondering what's going to happen with the testing sites. I understand more testing sites are coming out. I got something yesterday um, about. I just got it yesterday about these pop-up sites. Ironically, the sites have been open for 2 days. They're going to disappear on Friday. None was in Manhattan. The upcoming sites that will appear, none are in Manhattan.
right. The city has really been focusing their response on these hot zone areas that they've identified, the red zones that the state has outlined, and so forth, and trying to get testing numbers up in those areas. And they've been deploying their mobile testing units specifically to those areas to get better numbers. And I think a lot of this goes back to the test and trace approach. The more testing data that you have, the more addresses where people have had positive tests, the better you can do with calling people, identifying where they might have gathered, what events might be causing community spread, and targeting mitigation efforts to those regions. Of course, if you have test rates that are not ideal in many parts of the city, including Harlem and the Bronx, and there's work that needs to be done to increase those testing rates as well. But I think the city is really focusing their efforts on those areas where they're seeing positive rates of above 3%, as high as 8% in Borough Park. They're targeting resources there.
Mm-hmm. And we want to take a quick look at some of the testing data. So here's a map that we were able to obtain that shows now the dark blue areas in this map indicate the areas that are most highly tested. And the light blue areas indicate the areas that are least tested. And as you can see, the dark blue areas, and you can see the top 10 areas are listed, and we see Lincoln Square, Lenox Hill, Financial District, Flatiron District, Clinton Hill. We see Astoria, we see Manhattan Valley, Tribeca. So these are the areas that have the highest testing rates in the city. And they're also the areas that basically had the lowest incidence of COVID during this whole pandemic. And then we have another uh, map that we've been able to see. And now in this one, the brown areas, the dark brown areas indicate the areas that have the lowest testing. And so we're seeing Cypress Hills, East New York, Flushing, Hunts Point, Richmond Hill, Rikers Island, Bronx, South Ozone Park, Corona, Bensonhurst, Bayside. And so these areas are, woefully undertested, and you can see the brown areas in the Bronx, and you can see the brown areas in Brooklyn. And so this testing gap, concerns us tremendously, because how can the case data, how accurate can the case data be if there is such a wide discrepancy in testing citywide? So these are some of the issues that we've been concerned about. And in particular, you mentioned contact tracing. We never felt like we got an adequate explanation as to why the mayor took the responsibility for contact tracing from the Department of Health, which has had the domain knowledge in doing this and prepared to do it, and gave it to Health and Hospitals Corporation, which has obviously been, their resources have been stretched to the bone just dealing with treating patients and running the hospitals, and to then now have them have the job dumped on them to do contact tracing, which is something they weren't trained for. And so now we have activity split between the Department of Health and the New York City Health and Hospitals Corporation. And I think that that's also contributes to the dissonance between the data, because you have one agency doing something and then they're not necessarily communicating with the other, and all these things create delays in data collection, and we don't have the luxury of delays in data collection.
Sure. Yeah, I think one of the big issues recently has been how long it takes to get a positive test result back. As long as a week in some cases. I believe the response rate has gotten faster to a day or 2 days more recently, but that definitely impacts the data released, and particularly that cumulative data. That the data since the beginning of the pandemic, that's always data that is as of the date that the Department of Health receives test results or finds new information. And so the longer that delay is, if you're using that data to find where new cases are emerging, the longer that delay is, the less accurate that data is. Of course, the health department on the back end can adjust based off of the data of the test, which they do when they calculate their positivity rates. But again, that's not data that's published. So that testing lag absolutely does affect the data.
Yeah, it remains quite scary. I can tell you that. Something needs to change, and it needs to change rapidly. Because as far as we know, we've got 3 testing sites, and I believe one of them is going to stop doing testing soon. And so there's a long list of new testing sites, as you said, in certain hotspot areas. But if the data was lacking early on, you really have no idea how many people have been infected, how many people have passed this on, or we weren't allowed to go to hospitals. A lot of us had to continue to quarantine, while certain areas were told, listen, you've got a cough, come on in. These people have fevers and pain, and they can't get out of bed, and they're told to quarantine. And other people, where you had all of these testing sites and all of these medical facilities opening up, and they still weren't opening up uptown and in the hardest hit areas. And so if you're looking at an uptick, and we're seeing the possibility of one of the 3 for 98,000 people is about to close, and we're getting ready to go into this holiday season. We just don't know what to expect come January when this is all over. We have absolutely no idea what to expect. And so we're really thankful, for the information you're giving us.
Yeah, one thing I would say is that the testing rate for most zip codes, the median positive rate is about 1.5%, which is a a good number, all things considered. The World Health Organization, the state, and the city have all set this bar of 5% of being this threshold of knowing whether or not your data is reliable enough, if your case numbers are reliable. And so we're well below that. And so for the most part, we can say that in a lot of zip codes, even ones that are not getting tested as much as they should, for the most part, those case numbers are giving you a good sense of what's going on. They're a general sense. When you start to see that number increase, it's absolutely a worrying sign. The city has used a 3% threshold of increase of consecutive days of this number being above 3% as a way to target particular areas. And so when you see that number increasing, you know that you need to target more testing to those areas in a more concentrated way. And certainly in those areas in Brooklyn, we've seen that become much more of a concern in Brooklyn and Queens. But absolutely, the median is 1.5%. Some areas see rates as high as 2.5%, and the higher those numbers climb, the more concerning it is.
Now, the city also reported on the fact that the mayor is no longer giving certain types of zip code specific warnings anymore. Can you tell us a little bit about that?
Sure. Yeah. So that is that 14-day positivity rate, which is all the tests conducted over the past 14 days in a particular zip code, how many of those came back positive. And that gives you an idea of roughly if enough people are getting tested, and also if the number of positives are increasing, if there are more cases happening in an area. So when the City Hall initially identified these zip codes that were areas of concern, where they had seen that 14-day rate be at 3% or higher for 7 consecutive days, they began releasing those numbers for those zip codes at press briefings for a period of about 2 weeks. And that was really their headline number to indicate this is why we're targeting these areas. Now, the state stepped in to produce a different targeting strategy based off of basically block by block data, address data, to say this is the area that we're going to target for shutdowns. And after that happened, the city basically stopped announcing these zip code numbers, mostly to avoid a conflict with what the state was putting out. But that zip code data is useful for more than just looking at those specific areas of concern. It's useful for understanding the spread of the pandemic as a whole, and people have been asking for this data since the start of the pandemic. So even though there's been a specific focus on it around these targeted zones for school closings and business closings, it's been a topic of interest as long as the Department of Health has been publishing this data.
So let's talk about the state versus the city, de Blasio versus Cuomo, and how that's impacted things, because we've seen throughout this crisis several times that the mayor and the governor are not on the same pages of things. We certainly saw that in what's going on in Brooklyn. Now, I'm interested in knowing a little bit more about what data does the state have, and how do they get block by block data when you have areas like Carol has been talking about, where there's been, neighborhood by neighborhoods that there's not even one testing site. So how are they able to ascertain block by block data if they don't have enough testing?
So the data that they've been collecting is based off of the respondent's address. So if I get a test and I say I live at a particular address in Queens, that's the address that they use to target particular areas. So that's very accurate, point-specific data that, at least for the city, then gets aggregated into zip codes to protect privacy. So that address data is not something that's released to the public for obvious privacy reasons, but we do get that at the zip code level. Now, the state has direct access to that data and can make those determinations at a block by block level of where to target its mitigation efforts. But that data is really, again, based off of something that is not released to the public for privacy concerns.
Mm-hmm. Do you get the sense that the State Department of Health and the City Department of Health are working together on things, or are they on different tracks?
I think for the most part, the enforcement of a lot of the state's initiatives comes down to the city and its ability to go into certain neighborhoods and do increased testing, do increased enforcement of business closings and that sort of thing. So from a policy perspective, the state really wants to be in control of when businesses are being closed, when houses of worship are being closed. Schools remains very much in the domain of the city to make those decisions. But I think the mayor has emphasized that he wants to cooperate with the state on targeting these areas, and I think they've been trying to follow the state's approach as much as possible.
Mm-hmm. So going forward, what are your areas of most concern as we see these numbers start to uptick?
I think it's really one thing that we can't really see right now at a very granular level is where the areas that are being targeted right now, how they're doing. During press briefings, the mayor will occasionally comment on seeing rates stabilize or be at a certain level. That's not something that we can really look into in detail on a day-by-day basis. So we're really relying on the Department of Health and the mayor's office to release updates on that, to talk to community leaders when they see areas of concern. And then follow up on that by looking at the data that the Department of Health does release on that 4-week basis. That's the best insight that we can get into this. But it's really a matter of seeing if those areas that are being targeted now do improve and if any new areas emerge.
That's very interesting. We have quite a few meetings with several of our community health organizations and CBOs, and they're all battling for this information. You know, one has this information, one has this information. We're trying to get it together so that we can see how many people are being tested. And they're not getting a large number of people in these testing sites. But when you consider the one testing site that we did have was at the threshold of Harlem, you know, the borderline. And so Harlem is an extremely large area. And it was that one testing site. 65 people a day was being tested. Nobody knew it was there unless it was the CBOs that was passing this information on. People were fearful of testing. And what made it bad is that this was at a hospital. So, you know, we saw numbers of the number of people that died from COVID that didn't have to die because they were fearful of going to the hospitals, which were petri dishes. You know, so a lot of lives were lost there. And now, even now, these centers, these medical centers are not seeing a large group of people being tested. And I guess that's what we're trying to get to. Who's being tested? Where are you getting these numbers from? How many of these people are positive? There's so many people running around that's asymptomatic, walking around in the community, and you're still not paying particular attention because those numbers all of a sudden just pretty much disappeared, right, Bob? You've seen the block by block, zip code by zip code, they just completely disappeared. So we have absolutely no idea where those people that was tested stand, how many people they've been in association with, because everything opened up after that. We have a nice mall up here where people was running to the mall and associating with a lot of people. And so that's frightening that this information has been kept from us. And still, at this point, 8 months later, even the medical facilities are confused and working to try to compile their data, put it together, put it in a database so that we can see some numbers. How do you see that happening in the harder hit areas?
So I think it goes back to a unequal distribution of healthcare access. That's been the case from the beginning of the pandemic. As you showed that chart of wealthier areas being tested more, If you have better access to a hospital, better access to a doctor, you have good healthcare, you're more likely to go out and use those resources to get tested. And even when tests were in short supply, when it was much harder to get tested, that was also the case. So that continues to be the case to a large degree. The data that's available, the best way to look at some of the more in-depth zip code data is on the Department of Health website. They have a tab of COVID data, and they do have a couple maps that they've used to show the zip code data that they do release. So that will give you some sense of the number of tests and cases that are happening in particular areas according to the Department of Health. One thing I would say for the Department of Health is that they have been very good about documenting their data, about being very clear about what is usable and what is not usable, about releasing crosstabs based off of ethnicity, gender, age, comorbidities, that sort of thing. They've tried to release that kind of data as much as they can. So there is a number of data sources available to look at, but that zip code data remains one of the more challenging things to get at a day-by-day basis to see how things are changing. But again, that 4-week number is the best resource that we have now to look at that. And certainly keeping track of where testing is in low supply, where not enough people are getting tested, that's something you can see from that data, and definitely points to needing to get more people tested in those areas using whatever means are available.
So, Will, we appreciate you coming on. You've got an open door to come back and discuss these things as this pandemic continues to develop and unfold. And we didn't think we'd be here talking about it like this 6-7 months later, but here we are. But from here, it looks like we will be talking about this for another 5 or 6 months, and relative to the things that we're able to do or accomplish, I think is going to determine when we can finally stop doing COVID updates. But we appreciate the work that you and the city has been doing. Can you share with us just a little bit about the city? Because I think that there are a lot of people who may not be familiar with you guys. So just tell us a little bit about your online publication.
Sure. We're a nonprofit newsroom. We've been around for about 2 years at this point. We have reporters in every borough trying to produce up-to-date news about what's happening, and particularly around COVID-19. A couple projects that we have are our coronavirus tracker, which uses a combination of state, city, and national data to show what's going on right now with testing. So you can get that from thecity.nyc. Another significant project that we have going on right now is the Missing Them project, which is seeking to document every person in New York City who's died of COVID-19 and memorialize them in some way or another. So we're definitely looking for people to reach out on that project as well, and let us know if you've had a loved one who's died of COVID-19. We want to make sure that they're remembered in some way. And we have a team of reporters who are working on producing obituaries for as many of those folks as possible. So those are two big projects that we're doing right now. And of course, we have ongoing coverage of COVID-19 and trying to get at disparities in communities and how the city is responding to this pandemic.
Well, thank you for joining us. I put your contact information on the screen. He can be at Will C. Welch on Twitter, W. Welch at thecity.nyc. And we also encourage you to go to thecity.nyc and check out their coverage, subscribe to their online newsletter, because they are doing the type of coverage that lets us know that journalism still exists somewhere. So thank you for joining us.
News.
It's not fake news.
Yeah, thank you so much, Will. You really enlightened me, and I've been reading your articles for some time, and I'm always inundating Bob's mailbox with stuff. So I'm so glad that we saw that article that you printed, and we were really excited to have you here, and thankful that you obliged and came and joined us this morning with such vital information. Thank you so much, and please feel free to come back.
Appreciate it.
those of you who are listening, we ask you to check us out. We're here 9:30 every Wednesday morning live on YouTube and Facebook. Like and subscribe. We ask you to make sure you vote. You can vote early, vote now, or vote on November 3rd, but get out there and vote. And also, we're asking you to contact your elected officials to advocate for more transparency in the data, and more accounting of the testing that's going on. And above all, use your masks, social distancing, all the things that we were doing back in April and May. Start doing them again. Boost your immune systems. We want you to stay safe and stay healthy.
Washing hands, that's very, very important.
So thank you for joining us, and we will see you next week here on our Harlem Emergency Network COVID-19 update.